My name is Dr. Salvador Sandoval. I'm a family physician at the Golden Valley Health Centers. I work in Planada. Also, I work at the Mom-Mobile, which takes care of uninsured, primarily homeless patients, and I do home visits with elderly at their homes. I've been a physician with the Golden Valley Health Centers for about 34 years. Well, now at the Mom-Mobile, probably the majority of the patients that we see have at least the Affordable Care Act. We have some patients that still are in transition to getting the Affordable Care Act that are eligible, and then others that are uninsured, so they don't have health care, and they come to the Mom-Mobile. In Planada, I see uninsured that are usually on the sliding fee scale, and probably about 30% are uninsured, actually, that are seen in Planada. It varies. Some of them are acute illnesses, but others are chronic diseases, and like diabetes, for example, that's very common, and hypertension, heart disease, lung problems, stomach problems, things like that. But it's all primary care. I refer out things that need to be seen by specialists, and I follow along with the specialist. I think I'd be seeing them more for preventative care. Right now, we see a lot of people that don't have health insurance, so they delay care. Oftentimes, they'll decide not to get certain medications because of the cost, and that's a problem. We've seen people, for example, develop like end-stage kidney failure because they couldn't get the diabetic medications or the antihypertensives. And a lot of them are actually pretty young age, like in their 30s, early 30s. I had one recent case of a mother. She's in her middle 30s and she's on dialysis now. And she's been here. She was in the migrant camps when she was a teenager, went to school with my daughters, and all of the family were undocumented, but they eventually, it's a large family too, but they eventually all got some kind of documentation, either through marriage or other means. But she's the only one that didn't. She's the one that probably needed it the most. She had poorly controlled diabetes, hypertension, and then was developing urinary tract infections, and this damaged her kidneys quickly. So now she's on dialysis. And if she had had access to care, I feel that she would have still had functional kidneys at this point. Well, I think as a society, we've really erred in not emphasizing primary care. We're very good as a society in treating advanced diseases like heart disease. We can do interventions like bypasses, things like that. We can keep people alive with dialysis, with extreme measures that I feel that if we had invested more in primary care prevention, and education is part of primary care really, I think that we could have prevented a lot of illnesses. I feel it's something that would be beneficial, and it's really something that's the patients that would qualify from it really have been paying for anyway, because they pay taxes and they don't get any of the benefits from it, and this could help them personally in their health care, and then also I think society in general, because when we treat the end-stage kidney failure or the advanced heart failure, things like that, we're actually paying for it. All of us, whether we're documented or not, we're paying for that, and we should have primary care for everyone, I think it's more cost effective. It's been shown to be that way in other places like Canada, for example, where they offer primary care for people whether they're documented or not.